Hi there. It is suggested that a core part of addiction is that we simply can't bear to be present in our own lives. Drugs, gambling, pornography, food, even the screens of our cell phones are all ways of escaping the unbearable heaviness of showing up and being in the present. Addiction is a serious and intricate health issue that has deep personal, public, and social ramifications. My name is Dr. Daniel Keren. I am a chiropractor, and I am welcoming you to episode number 12, where I want to share with you 3 simple thoughts on the topic of addiction. Number 1, reframing the way we think about addiction. Number 2, what we can learn from Portugal 20 years after they've decriminalized drugs. And number 3, how chiropractic is helping to alleviate the opioid drug addiction epidemic that is sweeping Western civilizations. All that right here, right now, on Everything is Health is Everything. And welcome back. This episode is inspired in large part by an amazing TED Talk given by Johann entitled Everything You Think You Know About Addiction is Wrong. It's linked down below. It's a must-see for everyone. The ideas that Johann shared from his work on addiction really shook up everything I thought I knew about addiction. So this episode is a bit of a commentary on his TED Talk. Now, most of us are aware of the animal studies that suggest that if any one of us were to be locked in a cage with a big pile of cocaine and some water, we would all, with almost 100% certainty, overdose on the drug. And that is how the vast majority of us have thought about addiction. But later studies have shown that when faced with the same scenario, only this time given the option to engage in other meaningful social and physical activities, none of us would be lost. When in a happy and connected environment, the vast majority of us would choose water and connection over becoming habitual users. Now this is truly stunning. Rats in isolation, 100% overdose. Rats connected in community, 0% overdose. These findings lead us to the idea that addiction is perhaps less about powerful chemical hooks and physical dependency and more about interconnectivity. That the opposite of addiction is not sobriety. That the opposite of addiction is connection. Another idea that really resonated with me was suggested by psychology professor Peter Cohen. He suggested that instead of calling addiction addiction, that we call addiction bonding. We all have a natural and an innate need to bond. Healthy people connect and bond with each other. Traumatized or isolated people, or individuals who have lost or have not developed the ability to form deep connections with others, will bond to almost anything that will give them some sort of relief. For many, that relief comes in the form of drugs. Now it's easy and convenient for all of us to think of somebody else, like a stumbling junkie on the street corner, when we hear the word addiction. But if now we're calling it bonding, and we are all innately bonders, then it could be said that we are all addicts, only that some of us are addicted to more positive things and some of us are addicted to negative things. But it's most likely some sort of a blend of the two. Now each of us can ask ourselves a new question. Not what am I addicted to, but what am I bonding with? What rewarding stimuli, what substance, what thing, what person, what habit, what activity am I bonding with, and what is the result of that? Addiction is defined as a brain disorder characterized by compulsive engagement in rewarding stimuli despite adverse consequences. Here is a list of what is considered to be the top 10 most common addictions in the Western world. Alcohol, tobacco, drugs, gambling, shopping, sex, food, internet, video games, and, wouldn't you know it, work. Work, work. People are addicted to work. And what do I take away from all of this? Well, I'm not going to suggest that there is any single simple solution to breaking addiction, but it seems very obvious to me that connection with others is a key component in successfully unlocking the chains of addiction. I've personally taken part in interventions. I banded together with other people who loved the addict, and together we sat them down and gave them an ultimatum. We said that we were fed up with their behavior and that if they didn't shape up, they would be out. We threaten the bond. But are these interventions a successful strategy? Or are we taking the very thing that might well be the only thing with the power to bring people out of addiction and making it contingent on their good behavior? These interventions are micro-reflections of how societies around the world treat addicts. We punish and shame them, we incarcerate and further isolate them, and we set up barriers that make it very difficult to reintegrate into society and the legal economy once reinstated into society. Reinstated and reintegrated are two very different things. Let's look at a real-life example. So in the year 2000, Portugal, on the advice of an expert panel that was tasked with finding real solutions to their exploding drug problem, and just over 100 years that drugs had been widely criminalized in the Western world, Portugal decided to decriminalize all drugs. The plan was to take all the resources that were directed to enforcing drug laws and to punishing addicts, and redirecting those resources to reintegrating addicts. And now, 20 years later, after massive job creation programs giving microloans for starting small businesses, as well as other programs aimed at giving every addict a reason to get out of bed in the morning, the results are in. By all measures, there are dramatic improvements. Injected drugs, down. Overdoses, down. HIV, down. Overall addiction, down. This is a really amazing phenomenon that the rest of the world needs to take notice of and to seek to learn from. I would even say that it's vitally important for the rest of the world to take notice and to seek to learn from Portugal. That is because one of today's greatest public health crises is opioid addiction. The use of prescription opioid pain relievers has skyrocketed over the last 2 decades, and it has been a driving force in this addiction epidemic. It is estimated that 4 to 5 current heroin users started out with prescription opioid medications. With roughly 140 people dying a day from overdoses, opioid overdose is one of the leading causes of death in America. A new meta-analysis study performed by Yale School of Medicine found that patients suffering from musculoskeletal complaints who saw a chiropractor were 49% less likely to receive opioid prescriptions than their counterparts who visited other healthcare providers. Also, many medical associations have released statements strongly recommending chiropractic care in order to help stem the use of opioid medications. Chiropractic care is contributing to a reduction in the number of new addicts and is helping people avoid deadly addiction. So, a takeaway from today, we should all be seeking to continually deepen and strengthen the connections and the bonds that we have with others in our lives in order to avoid bonding to destructive habitual behaviors. One more thing before I go, if you're struggling with addiction and you're feeling out of control, you simply have to find the courage to ask for help. Help is available. I want to thank you for watching. I want to thank you for subscribing. Comments and feedback are always welcome below. My name is Dr. Daniel Keren, and as always, I'm here reminding you to always remember to never forget that everything is health is everything. Have an amazing day.